came in on the 2nd, he had an AVR, went in for a re-op for bleeding. On the 3rd, he had an ischemic stroke, went to the cath lab and had a large clot removed. History significant for coronary artery disease, and he also had a 4-vessel CABG in 93. So today for him is hospital day 7, ICU day 5, and he is no longer on the vent. Captain of the ship at this point is Dr. Coe. Active problem list, he's been hypotensive, lower cardiac output, and decreasing urinary output. Let's see, 24-hour events. He continues with the low urine output. We've given some volume. His creatinine has bumped up today to 1.6. Nausea issues, poor PO intake. His CVA appears to be resolving pretty much. He's got very, very minimal deficits at this point. Lab findings, his platelets are down to 36, decreased urinary output. The creatinine I mentioned up to 1.6 from 0.9 yesterday. Lines, he's got an IJ, today's day 4 for that. Tubes and lines that could be discontinued. His LA, we've lost the waveform, and so I'll ask for that to be pulled today. Not on antibiotics, not getting any kind of sedation. PRN drugs were all antiemetics that were given last night. 1 dose of pain medication, which really did not do very much. Care plans for today, we're going to increase activity, got him out of bed 1 time yesterday, we'll be getting him up again today, and to try and increase his PO intake. All of the bundles are met, mobility level 3 to 4, and he is currently PO negative.
All right. This was a great save, you know, having a stroke. We rounded on him on Tuesday, and he was just doing great. And by the end of rounds, remember, he got called back into the ICU, so almost an hour later is when he started having the stroke.
Yeah, he's almost completely, you can hardly tell any
That's wonderful.
strength difference bilaterally. His speech is going to see him again today and feels that she'll probably be done.
Perfect.
And he'll be off
Yeah,
of
he
the
went
lab.
for thrombectomy.
Yeah.
Basilar artery thrombus, and so that kind of, the goal was, or the monitoring was, hemiplegia. That's what happened.
And the first one to notice that there were changes was his wife, sitting at the bedside going, he's not really talking well anymore. So I came out and got the nurse, and things just got rolling from there.
Nice.
Yeah.
Yeah,
All right.
how it's supposed to work.
Yeah.